Hello and welcome to Live with Hillsdale Hospital. Today is Thursday, January 9th. We're in a new year. Isn't this hard to believe?
It really is.
2025. When you and I started this business, would we have thought we'd even see 2025? I mean, that's a long time. But we'll talk about your tenure at the health department. We'll talk a little bit about some exciting things that have happened over the course of the last few months, and some of the things that we're facing that are somewhat concerning, but that we can collectively get through as a community. So I'm excited to talk a little bit about that. We've had our friends from the health department on this many times. We actually started the relationship back during COVID, in which Rebecca would appear in the boardroom, socially distanced, and we were doing some broadcast. We then switched the platform to really doing more tele, so that way it prevented us from having to be in the same room together. Those went remarkably well. We had reaches at times of 50,000 during the height of COVID, in which people were watching what we had to say. And we felt that it was very important to bring to the community issues that are impacting public health. And oftentimes the work that you do is overlooked because it's just assumed people are getting their vaccinations. It's assumed that, we're taking care of the spread of this and that, but there's a lot of work involved in education, awareness, and then action that you take as a department. So we are excited to have you with us today. And for those who may not remember you both, let's do the introduction. And if I could start with Rebecca, if you could just talk maybe how long you've been at the health department, and then we'll throw it over to Kris.
Sure. So Rebecca Burns, I'm the health officer at the health department, and I joined the health department in 1994 in environmental health. So
you're right. I went to college, so that's okay.
Yeah. So yeah, that's right. And it started in the health officer role in 2016. So just before the pandemic, a few years, and then through it, and now the other side of it, and enjoy the job very much, and the work that we do to improve the health here in the three counties.
So prior to becoming the director and public health officer, what did you do at the health department? Were you?
I was a food sanitarian. So I did food inspections at restaurants. Boy. Yeah, that was my primary. That was my primary. You do a little bit of everything when you work in environmental health, but that was the primary thing that I did.
Yeah. My goodness.
Early career.
And you I want to pause and say you've done a remarkable job, Rebecca. It's never easy in the public's eye. It's never easy when you're dealing with public health because everybody has an opinion about vaccination, when someone should be, if they should be, should the government be involved? And you have to balance all that because you work for really some boards and some commissioners and other people, but you're ultimately responsible individually in your role for making sure that the health and safety of our communities are protected. And sometimes that means defying, certain opinions. And that's hard. It is very hard, but you've done that very well. You've weathered some very difficult storms. So congratulations on that one. And I'm sure we're going to have some storms ahead of us as we talk about, the future and some of the challenges that we're going to face. But it's great to have you back in the studio again. Thanks for your commitment. We appreciate it. Kris, Dewey, you're new to the health department somewhat. It's been what now? 2 years?
This will be my third year. I'm actually coming into my fourth.
Are you kidding me?
No, it'll be 4 years in May.
So. Now, Kris came out of the skilled nursing facility world. She was a nursing home administrator, and so reform can happen then.
Well,
right? Exactly.
It can happen. Yeah. So I came out during COVID, actually on the other side in 2021, and went into public health and started in health education and promotion, and did a lot of COVID vaccine clinics in the community, and did a lot of coordination trying to help people have access to the vaccine. And so then I went into emergency preparedness for a while.
You
and
did.
was doing that job, and now I'm back in health education and promotion as the supervisor. So it's been a very enjoyable career change, and I'm enjoying public health very much.
Does it feel like 4 years?
No,
really, it doesn't. When you're loving your job, it doesn't, does it? Yeah. No calls at midnight about, issues you used to deal with. No one ran out of the facility, right? Yeah. So it's kind of like, your day ends. That's great. Well, you're both obviously very busy, and I will respect your time today because you drove here to meet with us in the studio, and I appreciate that. But there are some issues that we really need to tackle this morning that are impacting our community and the health of our community that we really should talk about. And raise awareness to those in Hillsdale branch and other places that watch this video. So first of all, we're both experiencing an uptick in influenza.
Yep.
And it's different this year. We always say that, right? It's always different. It depends on the strain, etc. But it seems to be gripping a lot right now, starting in various different ways: sore throats, loss of taste and smell, that are causing some people to think that maybe it's COVID. And there are some cases that we're experiencing right now of COVID pneumonia. And so I don't want to talk about that per se yet, but I do want to focus on influenza. Part of the work that you do, education in, obviously, as we look at get your flu vaccination, and that's still very important. And I'm not going to steal your thunder, but I guess as we look at those cases, not just in Hillsdale, but in the state of Michigan, because you have to look at that, and then you're looking at them across the country, right? So talk to us a little bit about what are we experiencing. I'll start with you. What are you hearing from your hospitals that you represent and communities?
Yeah. Well, we noticed that the flu rates were high in the south, and now they are gravitating to the north. And we expected that, they are high in Michigan now. So a few weeks ago, before Christmas, we were still at a low level of influenza in Michigan, and now we have risen to a high level. And we are concerned because there are individuals that die every year from influenza. So one of the prevention pieces that we can do for influenza is the vaccination. And it's available just really everywhere. You can get it at your local pharmacy. You can go to your doctor's office. You can come to the health department. So it's just available everywhere. And we want to make sure that people recognize how important it is to take advantage of that protection opportunity and make that part of your annual stuff. So,
and when you think about annual stuff, we're talking about shingles, right? Shots. And COVID vaccination and flu vaccination, right?
And just because it's January doesn't mean it's too late. Because we start pushing, or we start messaging to folks in October, and get your flu shot. Usually October is considered the prime month for flu vaccine, but just because it's not October doesn't mean that it's still not important. Because we've seen flu seasons that have gone into late March, early April. I've seen them go into May. So getting vaccinated now still gives you protection through these spring months until we get past it and into summer.
And part of your job, education and awareness in the community, so what kind of steps should I take if I know I've got some symptoms that could resemble the flu? Talk to us a little bit about what precautions, what things we should be doing.
Sure. So if you're sick, stay home. That's the biggest one. If you're sick, stay home. And of course, we're 10 days past all of the holiday get-togethers, which is why we're starting to see that uptick. Is because people didn't stay home because it was holidays.
Get your Christmas gifts. Come on.
So, and it's natural human nature. I just got a little bit of a sniffle. It's not a big deal. It's not a big deal if you're a healthy adult or a healthy child or a healthy adolescent. But it can be a big deal if you're an elderly person or someone who's immunocompromised. So. But anyways, that's the first thing. Wash your hands often. See your doctor. Get tested if you feel that you have symptoms that relate to COVID or influenza.
Don't try to tough it out.
Right.
We watch that happen in bad outcomes when people just say, "I'm gonna work through it." You got to feed a cold. Let me tell you something. We have watched individuals present in the ER who are very, very sick. Some have to be transferred because they are so sick. Do not wait. The other should talk about hand washing. I think you just mentioned it, but it's huge.
It's huge. And if you're hand washing, if you really have to go out and you have symptoms such as coughing and sneezing, wear a mask. I know we all have mask
I have it on the
fatigue.
list.
We all have mask fatigue
there is
from the past several years, but realistically,
or mask shaming. Let's talk about that. And I think we as health officials need to say that it's appropriate to wear a mask if you're not feeling well in the public, to safeguard and to protect others. And you might say, well, it's my right to go to Walmart. It is, but think about your responsibility. Your responsibility is to make sure that my 85-year-old grandmother, who's there shopping as a single woman who has to go shop by herself, is not infected with any type of disease or illness.
Right.
And that's what we can do when we've said this before. And I know it's a polarizing statement, but do your part. And at the end of the day, that is very important, is to do your part. So if you do have to go out, there are people who have to go out when they're sick.
Absolutely.
You know, maybe they're single moms, maybe they're widows, whatever it is. We're simply saying take safeguards. Wash your hands, even wearing gloves, you know, is because we touch our face, we touch other things.
Right.
There are opportunities that you can help safeguard. But if you're sick, you know, and I know there's a stigma attached with wearing a mask. You know, there's a great individual saying, you know, that's cutting my, you know, my opportunities and my freedoms. That's not what we're saying at all. We're saying, think about the person beside you.
Yep.
Think about your own grandmother who could contract flu. How many people that I know in my career, Rebecca, a lot of elderly people who have died of flu.
Yeah.
Flu is just as deadly as COVID when you get in a population where pneumonia sets in and the patient is unable to recover. So I think those are an important fact to remember. Mask wearing, I know it comes with all kinds of complexities, but at the end of the day, it does help safeguard and keep our community safe. If you're sick.
If you're sick.
I'm not saying you have to run around with it all the time, but if you're sick,
Yeah.
you know, it is one step that you can take.
Yeah. And the other thing is, if you start feeling symptoms, it is good to go get tested, because
It
there
is.
are treatments that
There are.
if you start them within 5 days of symptom onset,
Right.
can reduce the amount of illness you're going to
That's
experience.
right. That's right.
And so for us to sit there and say, oh, it's nothing, oh, it's nothing, oh, it's nothing, and then we get to day 6 and we're still not feeling any better.
Right.
And now we've gone past the window for
Right.
treatment.
Any treatment.
And then you really are going to have
And then
to
you
tough it
are
out and
really
hope for the
toughing it out.
best.
Right. So early detection is early prevention. So if you get to your physician early, and this is where I'll talk about Hillsdale Hospital's opportunity. We have clinics throughout this county. We can get same-day appointments. If you're feeling sick, we have a walk-in clinic. You can even call ahead and say, I don't want to get anybody sick, so what can we do from the parking lot? There's opportunities to have those discussions. But in some cases, the physician really wants to, what we call, lay their eyes on you. They want to see what type of symptoms do you have. And not always is it appropriate to have that virtual visit. Sometimes physicians truly want to hear, they want to listen, you know, what your lungs doing, you know, do you have pneumonia, and those type of things. May send you for an x-ray. They may send you for additional services. End of the day, being seen early means that you can get treated. Right. And if you wait in that window, that could be problematic.
Well, and you know, a lot of people will say, well, I got my flu shot one year and I got sick. How
many times have I heard that?
And that could still happen.
Yeah.
It's not going to completely eliminate the opportunity to get the flu.
Right.
But it will help to minimize the symptoms.
It does.
So if you do end up with the flu, you're better off having that vaccination on board.
Right.
Than should you choose not to get it.
Absolutely.
Yeah.
So types of things that we do, Randy Holland, who's a very popular individual on this broadcast, has shared with us numerous times that, you know, we as a hospital look at the number of patients that we see in the ER and the number in our county, and we make decisions based on those individuals who have been diagnosed as having influenza. And the decisions that we make are, what type of units do we need to shut down to safeguard our other patients? Types of patients we want to safeguard: babies and obstetrics, and skilled nursing patients. So there's probably going to be some communication in the next few days about safeguards that we are going to take. And we have done this since I've been here in 15 years. Mm-hmm. This is not a post-COVID issue. This is something we've always done to protect the little ones and the elderly, which protocol is in particular areas that we limit visitors. And that's important because you're bringing in different types of, you know, kids are going to school, they're bringing that into a skilled nursing facility. Now you've got 40 individuals in one place captured, and it spreads like wildfire, Rebecca, when an individual either gets COVID or the flu in a facility like ours. So You'll be hearing from us. You heard it from us today that if you're feeling sick, talk to your healthcare provider. It's so important. If you have to go out, wear a mask. Consider getting vaccinated. All right, let's talk about vaccinations. All right.
Yeah.
So current, the conversation about pneumonia vaccination.
Mhm.
You want to talk to us a little bit about what that means, what the recommendations are, if there have been any changes?
Right. So the pneumococcal vaccine is one that is recommended, or has been for a number of years, recommended for children up to the age of 5,
Okay.
and then for 65-year and older adults. Recently, in October, the CDC did change that criteria, so that now adults 50 and older.
Mhm.
So they lowered the age range for the adults.
Okay.
And that was in recognition of the fact that we had some younger individuals that were needing that protection, and so the age range was lowered to recognize that they needed that protection from that vaccine.
Yeah. Excellent. So where does one get said vaccinations?
So this is another one of those, reach out to your pharmacy, your local doctor's office. We have it at the health department. And it should be just as easy to find as the influenza vaccine.
And most insurances are going to cover that vaccination, generally speaking?
Always check with your insurance provider to make sure that stuff is covered.
Right.
And if you're finding out that there are some concerns, you can reach out to the local health department, our office, and see if we have a program available to help.
Excellent. Thank you very much.
We may or may not, but it's good to ask.
And your website could be reached for identifying if there's any availability?
So the website, it's not like the COVID days when we used to have the scheduling on the website. They have to call their office to make an appointment.
Okay.
So,
but they can get the number from your website.
Absolutely.
As a minimum.
Absolutely.
Okay. And would you let our listeners know what that is?
Sure. It is BHSJ.org.
Nice.
Yeah.
All right. So it's RAM. It's RAM time. You know what that is?
No.
Radon
Awareness
Month.
RAM.
Exactly. Yeah. Not Dodge Ram, but RAM. Radon Awareness Month, man. Come on, get with it. So Rebecca, what the heck? What is RAM? So what's Radon Awareness Month?
So it is Radon Awareness Month. January tends to be that. Radon is a naturally occurring atmospheric gas that we can accumulate in our homes and in closed-in environments like this. It comes in through the cracks and crevices in our foundation. And then because in the winter we don't open our windows and it's stagnant within our homes, it can build up to levels that are unhealthy. Radon gas can cause lung cancer. It is the second leading cause of lung cancer behind smoking. So it is an important thing to test for, understand if you are living in a home that is more has higher levels, and to take action. So we have free test kits at the health department. You just stop in, pick up a test kit. We can give you instructions on how to use it. The instructions are also provided in the packet. And you follow directions, send it off. It's free to mail. The results come back to you, and then you can make some decisions about are the levels too high? Do I need to put a mitigation system in? And if that's the case, you can call our office and we can help you with your next steps.
Oh, wow.
But every home should be tested for radon. And you should test about every 2 years is the recommendation, because homes settle and new cracks develop in foundations and stuff. So it's a good idea to, if you've tested in the past, but it's been a while, to test again. And when it's a free test, how can you go wrong?
So if they don't want to get it from you, can you buy a radon test kit like at Walmart and
I think
CDC?
you can. I can get them at Home Depot and Menards and all the box stores.
Right. So is radon, can you detect it by the human sense?
No.
No, it's odorless, colorless.
So
Similar to like carbon monoxide is odorless.
So they're really not even going to know.
They're not going to know.
No.
All right. And then mitigation, though. I mean, that word scares me. So, could that get expensive?
Well, there is a cost to hire a contractor to come in and put a mitigation system in. I hesitate to give you any prices, but what's more important?
No, right.
Your health,
No, right.
Or
absolutely.
So
And are these like filtration systems, or do you know much about
No.
what?
They suck air out of your foundation basically and exhaust it to the outside.
Oh, very good.
To help
So-
remove that excess
Okay,
gas.
okay.
Yep.
So it's important. I mean, it's Good Awareness Month, and so they can stop by your office. Is that how they do it?
Mhm,
So
yeah.
pick one of those up in your office everywhere, like all your connections.
All of our offices.
Nice.
So and actually some of the MSU Extension offices also have them
Very good,
available.
very
So
good.
in fact, I think the one in Hillsdale does. So if you're downstairs at the lower level
Yeah.
of 20 Care Drive, you
Yeah.
can stop into MSU
Perfect.
Extension. Or if you're upstairs, we have them
Nice.
up there.
Very
So,
good. So you heard it here.
Yep.
Get a free kit and
Yep.
make sure that you're safe in your home and your children are safe.
Yep.
Maternal health awareness, Chris.
Yeah, so
Talk a little bit
January
about
is
that.
also January 23rd is Maternal Health Awareness
Yeah.
Day, and so for us, babies are very important, right?
Absolutely.
And moms are important. All families are important,
Sure.
but we
But the
definitely
most
want to make sure we're giving
vulnerable,
that next
yeah.
generation
Yeah.
the best start we can. And so,
Yep.
we have multiple programs at the agency to support moms, families, babies, and pregnant moms. And of course, our biggest one is WIC.
Yeah.
So our agency is responsible for WIC for the 3 counties, and we encourage families who may be pregnant or 6 months postpartum, or they have little ones under the age of 5. If you think that you may qualify, a family of 4 can make just over $57,000 annually and still qualify for WIC.
Okay.
Or if you receive Medicaid services or supplemental food benefits, you also qualify for WIC. In addition to the supplemental food, then we also you also have nutrition education as a benefit, and you
Okay.
also have the opportunity to have the little ones screened for their hemoglobin to make sure that they're getting enough iron and helping to monitor their weight and their height and making
Good.
sure that they're growing correctly. And we just offer a lot of educational opportunities for parents.
So, Chris, let's say that I am a new mom and never had children before, and I'm 6 months pregnant. When can I qualify for WIC?
So as soon as you have that pregnancy test.
Oh, so it's right then.
Yeah.
And the types of things that you do pre-birth for moms, you give them, do you provide supplies to them, or what is it that they get?
So they get a lot of education
Okay.
and a lot of support. We talk to them about breastfeeding, and we
Okay.
have breastfeeding peer counselors
Okay.
who are ladies who have
yeah.
breastfed and who can help give you support. They have the ability to text with you when you're having that crisis moment where you're not exactly sure what to do because the baby won't stop crying, or you have a question that you're afraid the baby's not getting enough to eat. And we do offer some additional supports and services for moms who are breastfeeding, such as breast pumps and different supplies that we can provide for a breastfeeding mom, in addition to the nutrition.
Well, that's
and that
incredible.
type of thing.
So the classes that you offer, so breastfeeding, classes and support classes.
So it's a lot more of like a one-on-one.
So it's one-on-one. Okay, but you
Yeah.
offer that.
Yeah.
And is that at a cost to the person, or
No.
they can get that for free?
No, and in the
Wow.
breastfeeding peer support program, you don't have to be a WIC mom.
Okay, that's
You
my other
can-
question. Is there a
right.
threshold?
So if you're not a WIC mom,
Okay.
you may not get some of the supplies and that type of stuff, but
Right.
you can still get that support. You can still
Okay.
call up our
Okay.
breastfeeding peer and say,
Nice.
"Hey, I have this question and I don't
Yeah.
understand. I have a concern. Can you
Right.
help me?"
Right.
So those breastfeeding peers can help any
Okay.
parent
Okay.
who's having difficulty with breastfeeding.
Wow.
WIC clients will be the ones that qualify for some of the other supports and
Sure,
services
sure.
for breastfeeding.
So WIC, is that a state program or a local program?
Well, it's a federal program that's
Administered.
administered through the state, and then we have grant funds to help
Right.
make it happen.
So they apply though through the state or through your office?
through our office.
Through your office.
Yeah.
Okay.
Mhm.
So they apply through your office.
Yeah.
They meet the threshold, then they get certain
Right.
vouchers that
So
allow them to
they
get
get a
certain
debit
things.
card.
It's like a
Alright.
bridge
So
card.
talk to us about that if you could.
Yeah, so WIC participants receive a EBT card that they
Okay.
can take to a local grocer.
Okay.
They are given a food list, and the food list will include everything from milk and cheese, eggs,
Oh,
peanut butter,
right.
beans, certain types of breads and cereals. They can get potentially yogurt. If the kiddo doesn't particularly like milk, they
Right.
can do some options there.
So does a participant get the list so they know
Mhm.
Mhm.
what they're like, this is
Yeah.
allowed and this isn't? Okay.
Yeah.
Yeah, and a lot of grocers have a little sign, where the UPC
Oh,
codes will
yeah, it
say
says
that
WIC
says
approved.
WIC approved.
Yeah, all right, very
Yeah.
good.
So,
Yeah.
and there's an app there's a WIC app that will tell them like where there's a local store
Oh, nice.
and what, they can create a shopping list before they
That's
go.
Yeah,
So they also can qualify for juices, fruits and vegetables.
right.
So, and
incredible.
they're actually making some changes in the coming year, I believe, to the food package as to
Yeah.
what's offered. So
That's great.
trying to keep up with the times,
Yeah.
because back in the day when I had my little one who's 33 this year,
Yeah.
35 this year. Oh my
Wow.
God, it's gonna be 35
Yeah, it's hard to
this
believe,
year.
isn't it?
You it was, you got milk and
Right.
cheese and eggs and peanut butter
Oh,
and, cereal, and
Yeah.
that was pretty much it.
Yeah.
And so now they've added additional options. So
Right.
now you can get the tuna fish and the
Sure.
fresh fruits and vegetables were not offered when
Right.
I was part of the WIC program. So, but yeah, it's a really great program for
Yeah.
families and for those who are not breastfeeding.
Right.
Then of course we supplement their formula too. So
Such a
we
great
provide so much
opportunity.
formula
Yeah.
for the little one.
And the cost of formula today.
It
Yikes.
is.
Are we experiencing any formula shortages today?
Have not heard
All
of
right.
any.
So we had that little crisis there for a while, but we're
Yes.
over that.
Thank
Okay.
goodness.
So you heard it here. If you're in need, please reach out to your local health department here and make those applications, because it can be very, very good for your children and yourself to get those nutrients that you need through this program. And just about every grocer participates in the program.
Yeah.
So, Kris talked to us a little bit about cervical health awareness, because that's also happening this month. A lot happening this
January's
month.
busy, right?
It is a busy month.
January's busy. So
Yeah.
January is Cervical Health Awareness Month, and we're encouraging everyone to participate in their PAP test. If they haven't had a PAP test, there's been some changes. So back in the day, we had them every year, right? So now if you're having negative tests, your doctor may recommend, and you don't have a family history or additional risk factors,
Sure.
it may be recommended that you only have a PAP test every 3 years,
Okay.
potentially. But again, that's a conversation between you and your
physician,
provider.
right?
But what we found is the HPV vaccine has significantly decreased the rates of cervical cancer among those who are vaccinated. So the HPV vaccine, it's the human papillomavirus.
There we go.
Papillomavirus. My goodness.
It's all right.
I need more coffee or
Go get some
something.
drinks.
Yeah. So the HPV vaccine can guard against 9 of the 12 high risk strains, and that virus is an indicator of potential risk for cervical cancer. So this vaccine can help reduce that
Wow.
risk for cervical cancer. It's recommended to start that vaccine, and it can be provided to men and women because men also carry HPV. So vaccinating your sons and daughters for HPV can reduce the risk for everybody involved. So, but you can receive it up to age 45.
Oh.
So if you didn't have the vaccine as an adolescent, and you haven't reached the age of 45, you can have that conversation with your provider to see if it's a good idea for you to be vaccinated at
Sure.
this point. But again, the key message is get with your doctor,
Right.
get your PAP test.
Yep.
They can do a blood test to test you for HPV. They typically don't do that until you're age 30 or over. If you are uninsured or are not able to get a cervical screening, the state of Michigan has what's called the breast and cancer control, cervical cancer control program.
Yep.
Now, while we don't have that at our office, those in Hillsdale County can contact the Lenawee County Health Department because they serve individuals from our county with that program.
Okay.
And then if you're in
So there's
Branch or-
access.
there is
they have
access. If
Okay.
you're in Branch or St. Joseph County, the program's in Kalamazoo. It is linked to our website. So if you need help getting a PAP test or a mammogram, please go to our website and
Excellent.
get the information to reach out to those 2 programs.
Man, what an incredible opportunity really to link up with the health department, receive education-free services. The work you're doing is just incredible. So thank you for all that you do for our community to keep us healthy. Looking at prevention is the key. I think that's very important in these months that we have, whether it's radon awareness or cervical awareness, whatever it is, it's an understanding that awareness is the key to stopping at times the spread of some of these things. So that I appreciate your hard work in those areas, and I know it's very tough work. We also gauge the community's response, right? What do they need? It's not just about what we think they need. And so we do that through a community needs assessment, and we do the community health needs assessment every year. It is a requirement that we do. And as a result of that assessment, we really gain a better understanding of what does the community say we need in services.
And so we like to see a cross section. Historically, we've seen, a lot of the, seniors in our community respond to it, but we really need to hear the voice of those 18 and older. What are the needs of our 22-year-olds? What's the need of our 40-year-olds in this community? So this is your opportunity as a community member to take this assessment. And it's anonymous, but it gives us an opportunity to know, do we need oncology services? And this is one thing that we identified years past in our needs assessment, is that there was a lack of oncology services and PET scan. So guess what we brought here? Oncology services and PET scan. One year we identified that there was a need for other type of services such as neurosurgery. What did we say? We need to have it. There's other conversations about pediatricians taking Medicaid. We've had those discussions, with the pediatrician and saying, all right, can we look at expanding Medicaid support services for that population? So what comes out of it is a lot of good. The voice of the patient, the voice of the community is heard. We take that needs assessment and then we push it out everywhere. So today you can take that assessment by accessing a QR code. And I believe today, if I'm not wrong, Miss Brown, we're going to be putting that on screen, or a link to the community needs assessment that we can do. You can also get hard copies of that at various places, including the health department.
Yes.
Scan your QR there. At hospital in our lobby area, there's opportunity there. We're actually doing live surveys. So we have some volunteer staff that are there during the day that are actually taking you through the survey itself. If you're a person who's supposed to sit down and take it on your home computer, that can be done as well. You can go to our Hillsdale Hospital website, hillsdalehospital.com, find out ways that you can take that assessment. But we want to hear your voice. The more we hear from you, the more opportunities is that we can create new programs and opportunities to serve your needs so you don't have to leave this area. And we've been successful in doing that. So we want to hear from you. Please complete that community needs assessment. It'll mean a great deal to us, but we can also then effectuate some very positive changes that over the years we've been able to effectuate vascular, neuro, oncology, and bring those services right to you, our community. So please make sure that you complete that assessment for us. There is a timeline on it. February 14th, they tell me, is the deadline. So we have just a little over a month right now to get that done, and we would just encourage you to do that. So thank you for being here. We are going to open the floor if there are any questions from our community. None? My goodness, we've answered everything. Isn't that incredible? That's great. So again, thank you for joining us today and the work that you do. One more shout out for your website, please, so our community knows.
So the website is B as in branch, H for Hillsdale, SJ.org. And your local office number is 437-7395.
We want to thank you, our community, our listeners, for your support. It is your support that continues to allow this hospital to generate the services that we do and to provide those right here in your own backyard. So we encourage you to use our services. If you're saying, you know what, you don't have what I need, tell us what you need, because we will get it here at Hillsdale. We believe that we can be a full continuum of care, as we've demonstrated, to you and your family for the needs that you have. If you're looking at ways that you can even volunteer here, so let's say you are getting your care here, but you're thinking, you know what, I have some free time. Go to our website, hillsdalehospital.com. Maybe you're thinking you want to change your careers. Consider healthcare. Another great opportunity under the career tab on that website is an opportunity for over 30 openings right now that we have in a variety of positions. Entry-level positions working in environmental services, up through community services, up through having us train you and put you through certification and classes. That's our commitment to you. The success stories are numerous at this hospital. We have taken individuals from laundry and promoted them into our lab. We've taken lab individuals, promoted them into nurses. It's just incredible. And Hillsdale Hospital's invested millions of dollars every year into our staff in our community to train and educate. And so we would encourage you, as we look at the new year coming up, there's going to be a new scholarship opportunity that we offer every year, and it's for high school seniors. If you want to become a nurse, Hillsdale Hospital will sponsor you. There's going to be an application that is available for you to complete. There's just very few things that you have to do. Sadly, we only had about 3 applicants last year.
What a great opportunity.
Isn't it amazing to get full pay?
Well, yeah.
Tuition paid for, discounted. You can come back and work at Hillsdale Hospital for regular pay, and you get to stay in your community.
Yeah.
It's a great opportunity. 15 years ago, when we looked at really beefing this program up, which we did, launched a capital campaign, raised over $1 million, we would have 20 or 30 applicants. And over time, that just seems to diminish. And we would encourage you, if you are listening today and you have a grandchild, a child who's a senior getting ready to graduate, we're going to be announcing very soon this opportunity for them to receive this nursing scholarship. So look at our website. You'll find all of that information there. To stay up to date on issues like we just talked about today with the health department, every Wednesday or Thursday, so once a week, we're going to host this type of environment where we bring guests in to talk about the happenings in our community, maybe the state, and even at times, even the nation. So please check out our lives. Those are very important. Every week, WCSR on Friday, 92.1. We're talking about some of these very same issues that we deal with in the studio. And then Buzz, we have an opportunity for you to listen to the Buzz radio station and other places that you can obtain information. Every week we have a podcast, a national podcast, Rural Health Rising. And so wherever you get your podcast, make sure to download. And we'd love to have you subscribe to Rural Health Rising. It's very important that you subscribe to that and then listen. Take copious notes. Maybe there's some things in there you didn't know about rural health, like 150 hospitals have closed in this country since 2010. And why we're raising the awareness is that we don't want other rural hospitals to close in this country. So your support of that podcast is important. And then hopefully you'll join us back next week. But until then, stay safe, stay healthy, and stay Hillsdale strong when you choose Hillsdale first.